Cracked tooth syndrome is a term we use to describe recurring discomfort, sensitivity, or pain in a tooth caused by an incomplete fracture or crack. The fracture involved in cracked tooth syndrome is often almost invisible and may not even show up on an X-ray. Like most everything else, your teeth age, and as they age, they may lose some of their original strength. For example, clenching or grinding can weaken teeth. Plus, if you have some large fillings or have had a root canal treatment, your teeth lose strength and can become brittle. And finally, it's just a fact of life that every day, your teeth endure a tremendous amount of pressure from biting and chewing. So if you bite down on a hard object like a piece of ice or a popcorn hull, for example, the force can sometimes cause a tooth to crack, especially if it's weakened. You may have cracked tooth syndrome if you find yourself chewing on only one side of your mouth because it's uncomfortable to chew on the other side. Your teeth are sensitive to either hot or cold temperatures or sweet or sour foods. You feel a sharp pain when you bite down, or the pain you feel is intermittent rather than constant. To diagnose cracked tooth syndrome, we'll first do a thorough exam of your mouth and teeth, focusing on the area that's painful. We'll typically take X-rays, which may or may not reveal the fracture, and we'll analyze your bite to isolate the problem tooth. Once we've identified the fractured portion of your tooth, the treatment we'll use depends on the location and direction of the crack, as well as how extensive the damage is. Some cracks only affect the outer enamel layer of your tooth, in which case we'll remove the affected portion and restore it with a crown or onlay to stabilize the tooth and protect it from further damage. But if the crack affects the deeper dentin or pulp layers, you'll need more complicated treatment, such as root canal therapy, before we place the crown. In rare cases, the crack extends all the way through the tooth and under the bone, and there is no way to restore it. In this case, we would have no option other than removing the tooth. Fortunately, most cracked teeth can be saved. The key is to find the crack early in its development and treat it appropriately.